Hello, my name is Benjamin Vidwen-Cloquet. I'm a partner at Ibis Capital and CEO and co-founder of HealthTechX 2050. HealthTechX 2050 is a global community of industry leaders, entrepreneurs, growth investors, and asset managers, all sharing the same goal: connecting capital and technology for impact. We focus on three industries: education, health, and food. Three industries currently transformed by unprecedented level of investment and innovation. Three industries that we believe will impact more than others the 2050 generation. Our community not only curates tech and investment trends globally in EdTech, health tech, and food tech, but we also every week put the spotlight on impact-driven innovators and investors to listen to their impact stories. Profitable, sustainable, inclusive is how we define impact. What is your definition? Welcome to HealthTechX 2050, and please join me to welcome our next guest.
Hi, my name's Ben Maruthappu. I was born in London in the UK and I'm still based there some years on. And I'm currently co-founder and CEO of Cera, and we deliver digital-first healthcare services in people's own homes so that they don't need to go to care homes, hospitals, or elsewhere.
Well, Ben, it's lovely to see you. Thanks for joining us. It's fair to say that in the 6 years that has elapsed since you co-founded Cera, you've achieved a great deal, facilitated over 30 million home visits. I think you're delivering about 50,000 home visits a day, which is equivalent to circa 50 hospitals. You're running at sort of revenues of $300 million, and you've achieved one of the largest health tech fundraisers in the UK at over 300 million. Is there a defining moment or a defining person that set you on this exciting journey?
I think there are probably a few different moments, if I'm honest, that led to co-founding Cera. The first one was back at the start of 2016. My mother sadly fell and fractured her back, and she needed support at home. And so I went through the process of trying to organize home care for her. And it was a challenging experience. I couldn't easily find a relevant home care provider. Even when I did, trying to get hold of them was really difficult. We wouldn't know which carer was going to arrive, what their name was at my mother's home. And so in the end, actually, my sister, aunt, and I ended up looking after my mother ourselves. And so that was definitely a challenging phase. But when I looked more closely at these home care and home healthcare providers and businesses, what I realized is that the people in them are very well intentioned, really motivated. They want to go above and beyond for patients and support them. They're just limited by the tools of their organization. In many cases, it's very backwards. Sometimes people criticize the NHS for being traditional, but I would say home care and social care is 20 years behind the NHS. So really quite archaic. Many of these businesses don't even use the internet, let alone trying to have digital systems for managing services. And that I saw as a real moment and opportunity to deliver better care by using technologies already available in many other sectors. So that was probably the most defining moment, but it was complemented by my time working as a doctor in A&E, where I saw patients coming in and out very regularly who didn't need to be in A&E. If they received better care in the home, better support in the community, they could be kept healthy there. Their chest infections or exacerbations of their chronic health conditions could be avoided, and it could take pressures off the front line in NHS hospitals. That became really clear to me around about the same time, so early 2016. And finally, I'd spent time in policy looking at how technology can be valuable in healthcare. And it was really apparent that there was a lot of focus on the use of technology in hospitals, which is important, but very little on how patients are doing in the community and in their own homes. But actually, what would be really powerful in healthcare is if people were able to monitor and manage their own conditions in their own homes which in turn alleviates pressures on GP practices and NHS hospitals at a time where demand is sky high. So those were some of the moments that really led to co-founding Cera.
And Ben, having spent time as a doctor and in policy and advising governments and the WHO, in addition to which, of course, you've done a lot in the private sector as an innovator and also as an investor. Given healthcare's systemic challenges, do you think the public or the private sector provide the solutions to those challenges?
I think ultimately it needs to be a combination. And the reason for that is every health system around the world is under tremendous pressure. There are growing aging populations that need more and more healthcare. There are limited budgets, particularly now at a time of real economic challenge that we're seeing internationally. And there are also really expensive treatments that are coming out down the line, such as cancer therapeutics, which will make a massive difference for people's lives, but are also tremendously expensive at the start of when a patient receives them. And so we need to think about how to square this circle and how to change the model of healthcare, because it's clear that doing the same as what we've tried over the past 10 or 20 years is not going to help us get through the next 10 to 20 years. We need a different model. And one of the greatest tools in this time, in this age, for achieving better, more efficient models, which also allow superior quality, is technology. And we've seen that in so many other parts of our lives, from how we now order retail goods that are delivered to our door rather than us going to shopping centers, how we may get food delivered to our doors, how we book an airline ticket or manage our bank accounts. Technology has transformed all of these industries, and now is the time for it to transform healthcare as well. This in turn, though, requires collaboration between the public and private sectors, because the NHS, while it can maybe develop some technologies like an app and so on, it's not going to start creating a portfolio of medical devices. That is not what, as a group of hospitals or primary care providers, they're set up, the NHS is set up to do. It's not necessarily going to come up with massive AI algorithms and invest tremendous amounts in data science, because it needs to invest in the front line, nurses, doctors, and other healthcare staff. So this means collaborations between companies, startups, large organizations that build technology, and health systems which are able to utilize that technology to make the most of patient care and support patients even better. That collaboration is really important. And I think this is analogous to how decades ago health systems needed to grapple with how to best collaborate with the pharma sector, because health systems were not going to start making lots of drugs and medications. They needed to rely on companies to do that research and development and to produce those medications themselves. And we've seen how that collaboration can work. It could be better, but we've seen how it works. And I think we need to strive for something similar when it comes to technology, so we have a more sustainable model of healthcare.
Now, Ben, you mentioned certain industries where technology has been truly transformative. Now, within some of those sectors, it's fair to say that the technology has, to a lesser or greater extent, removed humans or bricks and mortar from the equation. I wonder, to what extent do you think that technology can displace the doctor and or the hospital?
So I think most of healthcare funding is spent on frontline staff, nurses, physiotherapists, pharmacists, doctors, and nothing will ever replace the ability of a consultation where someone looks you in the eye and says, it's going to be okay. And we understand you've got this new medical condition. This is what we're going to do to support you to get you to a better place. Nothing can replace that. I think, though, what's clear is that we have far more need for healthcare services than staff available. And so what technology can do here is help our staff service and look after more patients than they would be able to otherwise. Technology can take some of the effort and lifting from frontline staff where possible, so that a doctor is focusing on where they can create the most impact rather than on the administrative work which comes with being a GP. And that's why I think technology right now can be so powerful. Automating and digitizing many processes, administrative work, regulatory compliance checks, that take up a lot of time in healthcare, but aren't necessarily where frontline staff can create the most value. I also think technology can be a great tool for allowing frontline staff to be even better at their jobs. If you think about data science and artificial intelligence, an algorithm is able to process huge volumes of information at the same time. And it can analyze all of the x-rays that an x-ray department would have done and use that information experience to sharpen the diagnosis that a radiologist does when they're looking at a new x-ray, potentially seeing patterns that that person may not be able to, and asking them questions. Could this be a lesion that we need to look into? Have you spotted this artifact in the x-ray? Have you noticed this? Data science and artificial intelligence can support frontline staff in making better decisions that build on the wealth of data in the health system, so that even if that nurse has only seen hundreds of patients, they can lean on technology that has access to millions of patients' data and in turn make more accurate decisions.
Now, thinking about frontline staff, it's fair to say that Brexit and COVID has led to a very tight labour market within healthcare in the UK. How is Cera addressing that challenge?
Yes, so Brexit and COVID has made it more challenging. Staff are more stretched than ever before. People, unfortunately, experiencing burnout even because they've had to work so hard over the past couple of years. I think, and what we're trying to do at Cera is, number one, support our current staff as best as possible with technology. So building on what I was saying before, taking away parts of the role that are more administrative, which may slow people down and where they can create most value for patients, so that they don't feel so burdened by their workload. But we can alleviate that with technology. That's one area of focus for us. Another area is allowing our staff to do much more. We do. So the algorithms I mentioned previously, we've built algorithms that support our carers and our operational teams with decisions so that they feel backed. They feel that they can lean on information from the millions of visits that we have delivered in the past. And the other way in which we're trying to address some of these workforce pressures that you've mentioned are that now, of course, with the economic challenges we're seeing in the UK and beyond the UK, unfortunately, as the country enters a recession, unemployment may increase. And we're seeing in different companies people losing roles and jobs, unfortunately. What we do at Cera is use our platform and use our training program to take people from other sectors who may have lost jobs and retrain them to work on the front line of healthcare, and in particular care, in a fully compliant way, but in record time, because it's largely digitized as a training process. And by doing that, we are giving people who've lost jobs valuable opportunities now to have meaningful new careers in a new sector, and that's the healthcare sector. Lastly, I'd say that there is international opportunities too, where we're trying to set up partnerships that allow people from other countries who also may have lost roles and be looking for new roles to work in the UK as healthcare staff. And I think that's going to become much more prominent in the years ahead.
We work with impactful technology businesses, all of whom view impact differently. I wonder, what does impact mean for you?
That's a broad question, Jamie. I think in terms of impact, for us, our mission is to empower people to live longer, better lives in their own homes. And so if we're supporting them in that, if we're allowing a patient to spend an extra day at home rather than having to go to A&E, or to be happier at home, so quality of life rather than just length of life, by picking up exacerbations in their conditions early and nipping them in the bud, or simply a carer going to their home and helping them walk in the park, living more independently, having a more fulfilling life. That's what we call, and what I would regard as, impact, because we're having a meaningful benefit to how someone lives. The key in turn is how we scale that. And so by using technology, at Cera, we try and scale the benefit we have and in turn the impact we're able to achieve. And at Cera, we have an immediate connection between the strength of our product and how we scale and the impact and benefit it confers for thousands and in turn millions of people.
So now, Ben, we move on to a sort of rapid fire section. Just a bit of fun, but I will fire sort of a few either or questions to you. So prevention or cure?
Prevention.
Fiction or non-fiction?
Non-fiction for me.
Work from home or work from the office?
Am I allowed to say both?
You can say both. We'll let you off.
Today I'm working from home, but I try and mix it up. And I think that allows for having people from across the country and other countries working at Cera, but also nothing takes the place of seeing someone face to face and building a culture that way.
Cats or dogs?
Dogs for me.
Final one, tea or coffee?
Coffee. I drink a few coffees a day.
I think
That's
you probably need a few coffees. How busy you are. Another quick one. What's the best advice you've ever received?
I may not be able to put my finger on the best, but a really good piece of advice that I've had when building Cera is to follow the data rather than the hype. And that's because there can be a huge amount of hype for trends, especially in startups and with technology. But they're normally just the next fad. And instead, if you focus on the data and what you're seeing in your own business and use that to improve your product and your service, that can be far more valuable in taking your company to the next level.
And just a couple more questions for you, Ben. So what does the next 5 years look like for you and for Cera?
So our ambition is to take healthcare into the home using technology. We've started mainly with carers looking after older people in the home because older people require more healthcare than anyone else. And carers we find is almost the stickiest part of services because our carers will visit someone multiple times a day, every day. But we're now expanding to other services in the home. We deliver nursing services in the home, telemedicine, medication delivery. And so in 5 years' time, we really want to be the holistic partner to someone receiving healthcare at home. So whatever it is they need, through Cera, they will be able to access it. We won't necessarily deliver the services ourselves. It may be through a partner that we have, but they will be able through our portal and our app to be able to access those services conveniently at home. That's one big area of focus. The other is expanding geographically. So earlier this year, we launched in Germany, and that business has grown tremendously this year, which is really exciting. But we're looking at other countries as well as we think about the next 5 years, because we see the need for great home healthcare is a global one. It's not just in the UK. It's where a lot of health systems are going because it results in better outcomes and it's more affordable. And we want to support and drive that movement.
And finally, we ask our interviewees to recommend who we should speak to next. So I wonder if you could share your thoughts on who we should speak to and why.
So yesterday I was catching up with Stephen Burke, who co-founded Echo, which was a medications delivery business that he then, they were bought by a strategic acquirer. And then he's moved on actually to build another company as well. So he's a serial health technology entrepreneur who is really mission focused, very centered on what a patient needs and building on his own experiences as a patient and as a user, how he can solve problems for other people out there who've been through what he has. And I found that really inspiring to hear about his journey, and I'd recommend he joins you here.
Perfect. Well, thank you, Ben. We'll seek him out. And thanks so much for giving us all your time this morning. And it's great to chat.
Thanks so much, Jamie. It's great to be here.